Hello everybody, and welcome to Species Specifics. Today we're going to be discussing cervids, which are our deer species. If you are new to this series, the goal of these lectures is to cover unique diseases of the different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about cervids for the NAVLE, so I've put them in no particular order. The first disease is hemorrhagic disease. This condition can be caused by either blue tongue virus or epizootic hemorrhagic disease virus. It primarily affects white-tailed deer. Clinical signs include fever, a swollen head and neck, and hemorrhages throughout the body. Brucellosis primarily affects elk of our cervid species. The disease is caused by Brucella abortus, which is a zoonotic pathogen to humans. Clinical signs include abortions and infertility, but animals may be asymptomatic carriers. Prevention involves routine testing to establish brucellosis-free herds. Chronic wasting disease is a reportable prion disease that affects cervids, causing neurologic signs. It is believed to be transmitted by contact between animals or contact with contaminated surfaces. Clinical signs include difficulty swallowing, ataxia, unusual behavior, and weight loss. Serous atrophy of fat, which is shown in this image, is a common end-stage finding at necropsy due to the starvation that can occur when the animal develops neurologic disease. Capture myopathy is a condition of muscle breakdown that is triggered by the stress associated with chasing and capturing. Clinical signs include muscle stiffness, ataxia, and sudden death. On postmortem, you can see pale areas of necrosed muscle. Treatment typically involves fluid therapy, muscle relaxants, and sedation. Mycobacteriosis in cervids is caused by Mycobacterium bovis. Cervids can act as a reservoir host and spread the disease to cattle, as well, cattle can spread the disease to cervids. Clinical signs include swollen lymph nodes, coughing, and abscesses in the lungs. There are currently no treatments available for mycobacteriosis in cervids. Winter ticks are the species Dermacentor albipictus. They primarily affect moose and can cause anemia and death if tick infestation is very severe. Clinical signs include hair loss, weight loss, and abnormal behavior. Treatment involves pest control products for captive cervids, and wild cervids are not typically treated for this infestation. Besnoidea tarandi is an apicomplexan protozoan that can affect cervids. It primarily affects free-ranging caribou and reindeer. Clinical signs include cysts within the connective tissue, and you may see associated alopecia or hemorrhage of the skin near those cysts. The meat of these cervids is edible for people, but it should not be fed to dogs as they are the definitive host for this protozoan. Liver flukes in cervids are usually Fascioloides magna. This species can affect both cervids as well as our domestic ruminants. These flukes use snails as an intermediate host. Animals may be asymptomatic with liver fluke infestation, but you may also see weight loss or death. On postmortem, you will see the liver flukes themselves or cysts that the flukes develop in. Echinococcus can use cervids as an intermediate host. Some studies suggest that up to 80% of moose are infected with echinococcosis. Animals may be asymptomatic, but you may see weight loss, ascites, and icterus. On postmortem, you can see cysts in the lungs or in the liver. Finally, we have cranial abscessation syndrome. These are abscesses from Truparella pyogenes that develop within the brain after there is a break in the antler velvet. This allows for an ascending infection, bringing the bacteria into and around the brain. Clinical signs include abnormal behavior, ataxia, blindness, broken antlers, and pus coming from the antler base. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there is also a link in the description of this video to where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.